Former Surgeon General Jerome Adams is criticizing the CDC for changing recommendations for people who test positive for COVID-19. The updated guidance cuts asymptomatic isolation time in half from 10 to 5 days and advises people to wear masks for an additional 5 days afterwards. In a TV interview, Adams said he's worried asymptomatic people will hear the guidance and end their isolation early. CDC Director Dr. Rochelle Walensky told CBS Mornings the adjustments were made so people would be more willing to follow them.
What we really wanted to do is make sure that these recommendations were more easily followed. We shortened the time to encourage people to do the right thing, especially those who are infected. We don't want them out and about when they are maximally infectious.
Meanwhile, the FDA warns at-home antigen tests could be less reliable in detecting Omicron compared to PCR tests. CBS News Debra Alfarone has more.
The U.S. is seeing a surge of new COVID cases as the country prepares for New Year's celebrations. The CDC reported yesterday hit an all-time high for the U.S. with more than 400,000 new cases. But as cases spike, the CDC is defending its decision to reduce quarantine from 10 days to 5 for asymptomatic COVID patients.
About 85 to 90% of viral transmission happens in those first 5 days, which is why we really want people to stay home during that period of time and then mask for the rest of the time to capture that last 10 to 15%.
While the White House has promised 500 million at-home COVID tests for free next month, there are some new questions about the effectiveness of the quick result antigen tests. The FDA is warning that the antigen tests may be less capable of detecting the Omicron variant, which could lead to false negatives. That's part of the reason why the CDC says a negative test is not required before coming out of isolation.
We don't know how this antigen performs with regard to predicting transmissibility towards the end of your period of infection.
The good news is the PCR test used at most testing sites is very reliable and can detect even tiny amounts of the virus. The bad news, lines are still long at most testing sites. Debra Alfarone, CBS News, the White House.
For more on this, I'd like to bring in Andrew Pekosz. He's a virologist at Johns Hopkins Bloomberg School of Public Health. Andrew, thanks so much for coming on with us. So for the majority of the pandemic, we've been hearing asymptomatic people can spread this virus. Part of the CDC's latest guidance, people can leave isolation after 5 days. We've heard from former Surgeon General Jerome Adams, who believes people should have to test out of isolation. So first question is, do you agree with him, or are we giving people a pass and just allowing them to re-enter society without any sort of checks and balances here?
Yeah, 5 days after you're test positive, if you're not showing symptoms, would be ideally confirmed with a negative antigen test. I think there are some issues about the antigen test that are being discussed right now, but at the end of the day, the data right now does suggest that an antigen test after infection would confirm that you're less likely to spread the virus. So I think it's the lack of any kind of, let's say, objective way to get out of the isolation period early that is a problem with some public health officials and this new policy.
And so you mentioned those antigen tests. Obviously, lines are long at testing sites across the country as they continue to look for ways to try to make sure that people at home can certainly take this test. Obviously, the FDA warning that the antigen tests aren't necessarily sensitive enough to detect the Omicron variant. Why is that? And what should people do if they can't get a hold of a PCR test?
Well, we know that the antigen test does work. One of the things we're not really sure of yet is what is the period of time in which you're able to spread the virus if you're specifically infected with Omicron. We know Omicron is much more easy to transmit. What we don't know is there a smaller amount of virus that's present within your respiratory tract that can mediate that transmission? Or is the same amount of virus that we've previously have shown with other variants to be indicative of being infectious? So it's that unclear nature of how infectious Omicron is and how many virus particles are in the nose of a patient when they're infected and with Omicron that's causing some of the controversy right now. But at the end of the day, the results are the common sense approach is pretty straightforward. If you're symptomatic, even if you have a COVID negative test, you should stay home because you're sick with something. Hopefully it's not COVID-19, but if you're feeling symptoms, you should stay home and not spread whatever it is you're infected with to your coworkers or family members.
But then what about testing as a whole? What does this mean for COVID testing moving forward? We talked about what those antigen tests could show. I mean, do we have to wait in these long lines in order to get a more accurate reading, or do you think that we just have to wait to see how this all sort of irons out in the next few days and weeks?
The other advantage of an antigen test is, they're relatively inexpensive, and you should be using multiple tests on consecutive days. And when you factor that into it, the fact that you can take 2 tests on consecutive days and get the results relatively quickly, together, those things make it almost as sensitive as some of the PCR tests. So I don't think we should dismiss the antigen tests right now. We should really just use them as they're really prescribed to do. Take them on multiple days in a row. A negative test doesn't mean you're not infected. It just simply means that you're not necessarily infectious at that period of time. And again, if you're feeling symptoms of respiratory illness, stay home irrespective of what your rapid antigen test is telling you.
Got it. All right, so a new preliminary study out of South Africa suggests that Omicron could give some people enhanced immunity to the Delta variant. So if that's true, how does that work, and what could this mean for the future of the pandemic as a whole?
Well, if there's anything like good news that's coming from this Omicron variant surge, it's data like just came out of South Africa that needs to be confirmed by other laboratories. But what it tells us is that Omicron is different from other variants, but it's not that different. And if you're infected with Omicron, you probably have protection against all the other variants that have been circulating since then. So it's a good thing because it's telling us that Omicron is still closely related to the other variants that are there. Vaccination, we know, helps against Omicron infection. And now we're seeing data showing that Omicron infection will provide you immunity against other variants. So it's a good thing because if we really sort of weather out this storm, get people vaccinated and boosted, the combination of vaccinated people and infected individuals will really boost the total amount of immunity in the population and make it less likely for new variants to emerge and spread.
I think we're all pulling for a little bit of good news, so I guess that's it there. Andrew Pekosz, thank you so much. We appreciate it.
My pleasure. Thank you, Rich.